All right, here's what we're going to do with the remaining time. First, members of the first panel, we'd like to hear from you, questions you have, any comments you have about this panel, and we'd like to devote a fair amount of time to that. And then I'm going to devote about a half a nanosecond to the committee and permit maybe one question or two at the most, and then we're going to open up to the audience. So members of the first panel. First panel. No, wait. First, people who are on the first panel, we want to hear from you. What questions would you have of this panel, or what comments would you make about the first panel, about the second panel? Then in the back. Thank you.
I'm Kelly Chandler, and I represent Itasca County Public Health from Grand Rapids, Minnesota. It's a very northern rural town. And my question in regards to the workforce is more about the needs of the specialization, special ed, perhaps for children with autism, or even the support services such as the mental health to address the social emotional needs, because quite frankly, teachers can't do it all. And I'm just curious if you have any insight as far as the needs and as well as what is being done.
Let me say before you answer that the committee has discussed this, and special ed has come up again and again as something that is really lacking. So this is a very important question, and we'd love to hear your advice about how we should handle it.
Sure, I'll answer a question which I don't have a great answer for, but what I can say is that what you said is exactly right. Teachers themselves in the classroom can't do it all. They already have plenty on their plate. They need an understanding of the mental health issues, and they need an understanding of the special ed and early intervention issues. And we need to help them with that. That's part of those competencies we've talked about. But there are programs that are doing preparation in early childhood mental health. There are states who have competencies in those areas. They're fairly widespread now. And I do think there's a movement afoot to support that development. Likewise, I think there's a lot of work now in early childhood special education. What has to happen, and I think it's starting to happen, I see it in California where I work, mostly. I work in other states too. What's starting to happen is there's more of a dialogue between the early childhood community and early intervention community, because I don't think we talk the same language usually, and we need to learn from each other. I mean, just as we talked about collaboration with families and collaborations among ourselves to learn, I think we need to learn really what that perspective of special needs when you've done deep inquiry into it, what you've learned and what kinds of insights you can share with me. And likewise, you need to understand the dynamics that I'm working with a classroom of children who have a variety of needs, and I need to individualize for all those children, some who have been identified with special needs and many who haven't.
Any more comments?
Well, I just think one other thing we need to think about is the mental health of a lot of the people who are actually working with young children. There's high levels of depression in the workforce. They're living with toxic stress. You know, we just did a couple of studies where nearly half of people are worrying about having enough food for their children. So I think as we're doing mental health services, we need to think about the mental health of the people who are working with young children.
Other questions from the first panel? Okay, we have more time than expected for members of the committee. So members of the committee, let's start right over here.
Hi, I'm Fabienne Doucet, and I'm at NYU. My question is, Marcy first brought up the idea of the seams, and then we had a comment about the threads that might go across the birth through 8 continuum. So I just want to hear from you what you believe to be the threads that go across 0 to 8.
You know, I was trained where I worked with infants and toddlers, then I worked with preschoolers, then I went with older children, then I went back to preschoolers, and then I went to infants and toddlers. And I also was in an interdisciplinary master's program at Berkeley that lasted for 3 seconds. So I think that, to me, that we would have much better teachers at all levels if you knew where kids started and where they were going, and if when I think understanding that whole spectrum is really important. I think there's so I don't know, to me it just seems like the fact that we put those themes in there really has to do a lot with the way these services have developed historically, and that K through 3 are really first grade and older public, was defined as a public good, and it was universal, and no kid's going to get turned out of a first grade classroom. But in early childhood, we've designed programs for various purposes at various times, and so that's sort of driven our personnel systems and the way we prepare people. So if we're really talking about a seamless thing, I think it's the idea of taking child development, which is what you get on the earlier end, and really pulling that through into working with older children. And I think some of the good things from early childhood is the idea that you work collaboratively with other adults. But I also think some of the things in K through 12, people have learned to be, well, I don't know, I won't comment on K through 12, but I'm just saying, I think there's things to go through, but it's really the system gets in our way. And
Sharon?
It's a small thread, but I think that there are efforts to do true vertical teaming at the pre-K through 3 level, which I think gets a little bit at what Marcy's saying, where really people who are teaching kids across that span are actually spending time in rooms together talking about them. So I think there's a little bit of that. I also think that there are people who are really thinking that the pre-K teachers who are in their building should actually be part of the school community. I think, that we've seen sort of what we used to see in special ed, you're out in the bungalow, you don't really count, has become what has happened to pre-K in the schools, but I think there's movement in that direction.
Yes, go ahead.
I think that the thread is child development, but then understanding child development and how it impacts the differences in both the curriculum and instruction and assessment and what the learning environment looks like, so that we're really thinking about connecting what we know about the span of child development in terms of what it looks like in a classroom and what is appropriate. And so if we do that, then we're going to really see the alignment in teaching practices all the way through birth through age 8.
A little more biography. I was trained in Montessori and then fell in love with the British Infant School. Those of you who, many of you will not even know what that is. But what pulled on me so much was Uri Bronfenbrenner's notion of developing an environment, a complex environment for children and adults, where thinking can happen. And I loved Montessori's notion of preparing the environment for what you want to see happen. And I have not, since starting my own schools, I haven't found places, except maybe Reggio Emilia, where I've seen any kind of attention to purposefully shaping the environment for high-level thinking among children and adults. And this we're talking about nursery environments too. So that's something I would really want to attend to.
I'm going to move on to, next question. It's coming right behind.
Hi, I'm Marjorie Kostelnik from the University of Nebraska. You talked about barriers and some of the barriers we had to overcome, but one that hasn't been brought up yet by either panel is the capacity of the community to provide the kind of practicum and experiential kinds of experiences that we want early teachers to have. I work in an environment where we put 1,000 students out into our community of 200,000 people. So we're asking a lot of the community, and we are finding it a challenge to find the high-quality environments that we are looking for. So I'd really love to hear the panel talk about that issue in terms of teacher preparation from birth through age 8.
I had, when I was at NYU, I had a grant from the Robin Hood Foundation to do professional development in Head Start. So I won't tell you all about that. But I will say that in the 4 Head Start centers in which we worked, we had a, I can't remember what we called them, but we had a mentor who was in the center in the first year 4 days a week. We had a meeting back at NYU every single week with our mentors. And gradually, the environments changed over the 5 years that we had this grant, because we were embedded in those settings, but gradually over the years pulling ourselves out and turning over what was turning over the running of the classrooms and the assessment and all of that to the teachers in place. I think it has to be that kind of thing that enables a real shift in an environment. And it can't happen in a year. It really takes time.
We have to invest in quality on a wide scale. I think we have examples of quality, and I'm sure you have found every good one in your community to place students. And when I think of the birth to 3 age range, I think of group size. I think of opportunities for caregivers to develop primary relationships with children and families that endure over time, because a relationship isn't something you start and stop and then start another and stop another. I think all of those factors are going to play into it, and we don't have the level of investment we need for that quality on a broad scale yet. I agree. And so we not only have to talk about preparation, but we have to talk about the conditions under which those well-prepared teachers can move out into the world and have an opportunity to do all the good things they've learned.
I'm not sure that this addresses things on the scale that you're dealing with, but in Los Angeles, some time ago, we had a chance to do a project called Best Practices in Early Childhood, where we really had the communities that we weren't usually using for teacher preparation to tell us about what they felt was the best child care, the best educational experiences for those children. And what it did was that it helped us really expand our notions of quality. And I think it really helped the people who we were placing there to have experiences that they would not necessarily have in the ways that we usually define quality.
Another question from the committee.
Albert Watt from the National Governance Association. Many of you talked about the importance of sort of a culture of, or ethic of inquiry in the teaching profession, whether it's looking at their own practice or looking at student data, or just kind of the kid, just the family engagement, that sort of thing. So I'm wondering if you can comment on the extent to which federal or state policy supports that kind of culture and kind of way of working, and what you might change, in those arenas, or federal policy, to be more supportive of that kind of working style.
Sharon.
Okay. If you look to Japan in terms of their time allocation, that a good portion of their school day is spent in teachers talking to each other. And more that opportunity completely disappears for teachers. Certainly the 0 to 5 population teachers have such a hard time, maybe nap time, but gee, how are the ratios, and who has to be in the classroom, and no, I can't come. And then, with the K-12, K-3 population, it's even if the time exists, how much help do teachers get to really use that time wisely? I think that it's all about priorities, and if we don't think it's important for teachers to talk to each other, to talk to families, to talk to the universities, to talk to everybody, then it's not going to happen. So would you make that happen?
Yes, go ahead.
Yeah, I think it's a matter of resources, so that even when you have people trained into this model of inquiry and sharing of knowledge, if they work in programs where this isn't possible, there isn't the resources to make that happen. It isn't just a matter of not knowing how important it is, but we really don't have the resources in the birth to 5 settings for that to happen. And, I cannot begin to say what has to happen during nap time, aside from the fact that children don't all go to sleep, right? And those of you who have parents can understand. So we not only have the need for teachers to be able to meet with each other and inquire and learn from each other's practice, but there's issues of reflective supervision, there's preparation of materials, there's meetings they need to attend, as well as attending to children. So until we are serious about thinking about the resources needed in terms of staff to make our early childhood programs true learning organizations where the adults are learning as well as the students, then we really aren't going to be able to make that happen. So again, make it happen, Albert.
Well, right, and I think the other side of the lack of resources is the turnover that takes place in those programs. And so you cannot improve a program if you're constantly trying to find new staff, and that that there is research that shows that programs that are able to improve in their quality have a certain level of stability, and the ones that can sustain that quality are the ones who keep their skilled teachers. So if you have that constant churning, you have to establish you want teachers to have time to talk to each other, but actually you have to have teachers get to know each other if you're constantly getting a changing cast of characters. And I think the other thing that maybe people don't realize is a lot of teachers are being moved around classrooms depending on who shows up on a given day. So even the idea that people are working with the same group of children all the time is not necessarily, common practice. So I think it's a question of resources, but it's, people will always say, well, I want good cheap childcare or good cheap, preschool, and it's, it's sort of, we're paying for what we're paying now, and there's cost to the status quo. That, not to mention that people are using federal income supports and the lost opportunities of improving our programs, but just turnover alone costs our programs so much money. They estimate in K through 12 that turnover ranges from $3,500 per incident of turnover up to $8,400, depending on if you're in an urban or rural thing. I don't quite understand that, but in any event, there's a range. So even if you took the low number for early childhood, do we have any idea how much money that we're spending every year on just trying to keep these programs staffed? And I would say the other thing is that there is a big, big hole in our professional development bucket, because we're training people all the time. We don't collect data on whether or not those people are staying on the field, but we pretty much know that a lot of them aren't. So I think there's sort of cost and efficiencies in the current system that need to be taken into account as we're thinking about the resources, the additional resources we need.
I just want to add one thing. With the Robin Hood grant, Robin Hood Foundation actually gave money to each of the centers with which we worked for subs to be there on the days in which we worked with the staffs of those schools. And I think that kind of thoughtfulness around the way you give money and the ways it might be allocated is critical to making a policy work.
Quickly, okay.
I'm thinking about what kinds of changes in policy could accomplish this, and I just want to draw attention to the Military Child Care Act that provides for the resources that allow that to happen, provide for a role that is essentially a mentor coach. I think they're called training and technical assistance specialists, but it's a designed role that works in every single one of those programs, and they're resourced so that the teachers have opportunity. So it's not that we don't know how to do it. We have a good example of it operating successfully. We just need the resources put there.
Now, questions from the audience, and including the audience on the web. So go ahead, please.
Hello, my name is Alan Shen. I've also broken the microphone.
It could be defective.
Yeah, it could be. And I'm the founder and president of an organization called Real Fathers. I'm also a recovering elementary school principal and special educator. So that's part of my perspective and asking two questions back to back. The first one, Francis, is for you. You talked about the aerial view and not remembering earlier than third grade. As a principal, the best professional development I offered to my teachers was what I learned from the children who were being taught in terms of the qualities of best teachers versus, by the way, favorite teachers, which are two very different things. So I would look at and ask you the question of why do you look only at the aerial view beginning in pre-service rather than what we all know from what we learned as children about good teaching?
In the aerial view that I described, if you remember, I talked about the apprenticeship of observation that Dan Lordy talks about as being that time that we have spent in school. And that is what our students carry into the teacher ed program, is their own experience of watching teachers. Actually, it was one of the assignments I used to do at NYU, was ask my students to interview kids, parents, and teachers about who a good teacher is. And they, of course, learned that. But they didn't come in having asked that question. They came in drawing on their own experience.
Sir, we have several other people that want to ask questions, so I'm going to ask you to forego the second question so we can go to someone else. Yes, over here.
Hi, I'm Louise Toal from Mathematica Policy Research, and I was very struck by what Sharon said about observational quality assessments as professional development tools. And I'm curious to hear from the panel about whether you think we have the right kinds of tools available. Tools are now being used both for professional development and also for assessments and high stakes accountability measurement. Do we have the right tools for infants and toddlers, for mixed age settings, for family child care, et cetera? I'd love to hear your thoughts on that.
Members of the panel, I can give a short answer, no. Go ahead, Marcy.
Well, I mean, I think I already said, like, I think we need more tools that help us tap what teachers are experiencing, and more tools that look at the environment for adult learning, because I think that if we're asking people to change their practice, we need to get more feedback about that. I think that there is this problem. It's not just what tools we have, but how we're using the tools. And there's a little kind of teaching to the test going on with some of the tools, which I think is both, there's a helpful piece about that, but there's also a part where I think people are thinking, I have to do better on how I'm being scored. And I worry about that for our teachers.
So I think that some ways to avoid that, because I see the same thing, is that we really have to get focused on identifying effective instructional practices. And I don't mean 200 of them, I mean 10 of them. And to use the research, the predictors of good outcomes for kids, the culturally sensitive things, the things we know really support our struggling learners, and to then link the qualities that we find in our observation measures to those practices, because then I think it changes the conversation and it doesn't make you so much teach to the test.
Go ahead.
Hi,
Lawrence Dupley, the Administration for Children and Families. I want to go back to something that Ron mentioned very early in the panel, which is thinking broadly about those working with children birth to 8. And a lot of the conversation here, my perception, is focused a lot on classroom-based early childhood ed. If the panel could comment about home visiting specifically, but also early intervention services and family child care and other recommendations for those fields and other fields.
Go ahead.
Well, I think that you've hit on a really important piece. I think we're in our second generation of quality rating and improvement systems that began by focusing on child care and perhaps school environments, and now are really expanding in their system building to think about the needs of children in other areas in terms of health, in terms of early intervention. And so we're seeing the efforts to engage not just family child care, but home visiting and early intervention and special education. And so I think that the framework of our quality rating and improvement systems is going to be the lever, it's going to be the model where we're going to start seeing some focus on the workforce in those areas as well. So I know best Illinois, and our a credential that's related to coaching is our first truly cross-sector credential that's being developed, but a home visiting credential is clearly also needed, that and figuring out how does that fit in with the core knowledge that you need for an infant toddler credential, or for a family child care credential, or for a director credential. So I see that really it's that QRIS framework that's really going to be the lever for that work in the future.
Over here.
Hi, Chris-Ann Gale with the U.S. Department of Education. I'm wondering if you could please comment on state policies around teacher licensure and around state standards, and whether or not there are changes that we can make in either of those areas to encourage more of a birth through 8 continuum. Thank you.
Terry, go ahead.
Don't know if it's proper to have to speak 2 times in a row. I'm very excited about something that is going on in a very reciprocal way and in Illinois, and I see that I'm sure it's going on elsewhere, or if not, it will. And that is when we developed the competencies based on standards for the early care and education and infant toddler credentials, we did that by alignment with the NAEYC professional preparation standards and the Illinois teacher preparation standards. Well, guess what? Now we've moved to a redesign of the licensure, and with that comes the need now to redesign the competencies and alignment of standards. And now our State Board of Education has looked to our state professional development system and our early childhood credentialing as having really good competency-based interpretations of those standards to build it into the standards for the teacher preparation for early childhood licensure. So I see that we really are at an integration, at least in Illinois, in terms of birth through 2nd grade. So we're almost to 8, not quite, but it is happening.
Well, I think that state standards and sort of pressure for people to develop, or not pressure, encouragement for people to develop birth through 3 or birth through 2 really helps to stimulate the changes. I mean, sort of dialectical, going back and forth. I'll give you an example of what not to do, which is California, which is we used to have a P through 3 credential back in the 70s. I have one for life, but they discontinued it. And then they decided that people working in early childhood didn't need a credential, so they developed a permit. Now we have our state preschool. We don't have to have a credential. The Commission on Teacher Preparation has really resisted doing a credential. Now they're finally considering it. Meanwhile, we just started transitional kindergarten. So since there was no early childhood credential, it meant if you had a credential teaching children K through 12 or K through 8 or whatever it is, that was going to pass for the early childhood credential. So I think and then that means that we have now all these people working with 4-year-olds who don't have any specific early childhood knowledge. And yeah, ouch is right. And so, you know, I think that the relationship between the credentialing and the standards and how that drives what happens in the state is really important. And, you know, don't even get me to explain why we have that in California. But
do we have questions from the web? Go ahead.
I have a question from the webcast. How will the administrators' training make its way down to early educators?
Say that again?
How will the administrators' training make its way down to early educators?
I'm not sure I understand the question, but if we're talking about preparation of leaders through either a director credentialing system in states, you heard earlier that our center has developed a national director credential with content in program administration, leadership, and management. It is applicable for birth to 3 program leaders as well as 5 through, children who are 3 through 5. So really those issues are relevant across that birth through 5 span. So I think what's more critical is how do we make sure there's good alignment between the competencies that we need to lead programs birth to 5 and the competencies that we need for kindergarten through 3rd grade. And that's where the rubber hits the road and where we really don't have alignment at all. I want to just point out that in the state, we've got, in the country, we have 5 states that require even 1 course in program administration in order to be licensed to be a director of an early childhood program. We only have 4 states that require a degree at any level, and 3, I think only 1 of them is at the BA level, the rest are AAs, and that can be in any subject matter. That's how discrepant the requirements, the preparation, the understanding of the competency to lead a program in a birth to 5 environment is from what we know is important in that K through 3 environment. So we have a lot of work to do here.
Our time is up. Please join me in thanking the panel. And let me thank the audience for such fine questions, and we hope you hang around for this afternoon session. Thank you.